I'm sure really that locally the challenges are very similar to nationally, but we have faced a few particular issues over the last, well, decade really, if actually more, 20 years. Um, I mean, I was elected in 2006 on the basis of a big campaign that we'd had back then to try and stop the moving of maternity services and paediatric services out of our local hospital in Huddersfield to Calderdale, which is part of the same trust. We felt there were big safety issues with that, alongside a centralisation of a number of other services, and it was around the issue of wanting to protect funding at a privately financed hospital, PFI. And we had a big campaign around that, and I got elected onto the council because of that campaign. Unfortunately, we didn't succeed in keeping those services in Huddersfield. We warned at the time that there was going to be more to come, and we expected that the trust would want to try to move A&E. And obviously, a few years ago, they did exactly that. They came for A&E, and at which point we launched Hands Off HRI, Hands Off Huddersfield Road Infirmary, which was a much bigger campaign. And we did manage to keep an A&E service, not quite a full service, but at least more of a service than we were going to get in Huddersfield. So we had a victory, not fully in the sort of sense of keeping all the services here, but we certainly achieved a great deal with that campaign. And to be honest, I suspect that in the future there will be further attacks of that similar kind, that they will probably want to move more services over towards Calderdale because of the huge debts that they have on that hospital from the private finance initiative, basically. They have to keep services there, whereas Huddersfield they can afford to wind down because it's not funded in the same way. It was built a long time ago with treasury money, public money, and therefore, they can let that go. That's the attitude. So we're expecting more fights. There are also obviously big issues in terms of NHS funding generally. General practice is under threat massively, hugely underfunded. I mean, the whole of the NHS is underfunded, but general practice is seeing particular crisis at the moment. I would say we've got a shortage of GPs, that most practices can't afford to employ more GPs, and so there are new GPs coming through the system and unemployed in general practice. They're having to go and find non-medical jobs in Aldi and things like this, which is totally crazy. We've trained these people for years, and then they can't get jobs in general practice when we're desperately in need of more doctors. I mean, in the last decade, there's been stagnation of GP numbers, and but patient numbers climbing hugely, and we just don't have the resources we need. So when people complain about not being able to see a GP, it's generally true. People struggle because there just aren't enough of us. And we are the front door, really, of the NHS, but hugely underfunded. I mean, I think it's something like 40% of the last cohort of GPs that applied for jobs couldn't get jobs. And they're expected, well, the Royal College of General Practitioners is expecting that to be even worse in the next cohort of qualified GPs, because they've increased the number of training positions and encouraged people to go into general practice because there's a shortage, but they've not given practices the funding to be able to employ these people once they have qualified. Completely, I mean, it's a crisis that's been in the making for a long time, but this government are not doing enough to resolve that crisis, I would say. But the privatisation process began under Thatcher, I would say, and then was accelerated under New Labour, yes, completely, and then really there was an increase in funding around that time because the economy was doing quite well, but then subsequent governments have not funded the NHS anywhere near to the degree that it is required to provide a decent service for people. So things have just gradually, I would say, deteriorated really within primary and secondary care. But of course, the other big elephant in the room is social care, and one of the major problems with all those governments, including this one, is they do not have a plan for social care. And as long as social care is not being funded and they're cutting council funds massively, then that will put pressure on the NHS, because patients, when they're medically well, need to go somewhere, and hospitals are full of people who are medically fit for discharge but don't have anywhere to go to look after their care needs. Or if there are places for them to go to, they can't afford, and people can't afford the care that they need, and so end up bouncing back into hospital because they're not really looked after properly and they don't know how. Totally, yeah, that's what we need, as well as the end to all privatisation that exists within the NHS, because that is diverting huge amounts of money into the private sector and away from publicly funded health services. So, you know, the interest payments, for example, on Calderdale Royal Hospital are enormous, just on the basis of that building, and they're all going to the private sector instead of that money being fed back into where it's needed to provide care. So I think renationalisation of a lot of the buildings and services that have been privatised as well is a key part of making the NHS work better, alongside, as you've said, a nationalised public social care system. It goes without saying that there's huge pressure, huge lobbying pressure, and huge pressure on the back of those fundings for people to get some payback. And so Labour is serving the interests of the private sector in healthcare. Private insurance companies and pharmaceutical companies, you know, are definitely going to be looking for some payback for any donations that they're giving. They're not doing it out of the kindness of their hearts. It's clear that they want something back for that. And the same was true actually under New Labour. The influence of the private sector was huge at the time when Alan Milburn was Health Secretary under Tony Blair, and it was a problem going back then as well, and remains the case. You know, you see the way that private hospitals, independent sector providers have been used to do operations as well, funded by the NHS, in order to, they say, reduce waiting lists, but that money is going into the private sector when those operations, the nice, easy, relatively risk-free operations are being done in private sector independent hospitals, and the difficult, tricky, riskier procedures are having to be done in the NHS. The NHS has to bear the burden of the increased cost of that, providing things like intensive care and crash teams and all the other resources that are needed when those riskier procedures are done. You know, and yet they don't get paid more for doing those procedures. You know, a hip replacement, a riskier hip replacement done in the NHS doesn't get more funding than a nice risk-free hip replacement done in a private sector hospital paid for by the NHS. Well, I think bringing those things that are privatised back into public ownership is a big part of that, because, like I say, we lose a lot of money in interest payments on buildings and things like that. So that pays huge amounts of finance. There are hospitals that are run by the private sector, NHS hospitals that are run by the private sector around the country, that actually fine the NHS if their capacity goes above a certain level. So, for example, if a hospital, a privately owned hospital that is an NHS hospital, I know this sounds strange, but the building is owned by the private sector, if that is filled above a capacity of, say, 96%, then the private company will fine the NHS for that. hospitals are full to the brim, so of course that's happening on a regular basis. All the things I've just mentioned about the way that money is siphoned into the private sector is a problem. I also think that the pharmaceutical industry makes huge amounts of money out of the NHS. And again, if we had some kind of nationalised pharmaceutical business is the wrong thing, but organised drug supply and resourcing run public for the public interest, and based in this country, then we could definitely save huge amounts of money on pharmaceuticals, or nationalising some of the existing pharmaceutical companies that are based here as well would be a start to that. So there's lots of ways that funding could be raised, I think, within the existing system by just pulling money back, but also by taking steps to fund it better and taking steps like a national social care service, which would actually ultimately in the long term save money. I think there's lots of other things though as well in terms of generally public health initiatives and to improve people's standard of living generally and improve people's lives generally, to improve their health and make them healthier longer term and actually cost the NHS less in the long term. So I think it's also about having a long-term plan and not just a constantly very short-sighted vision of what we can do. There's lots of small but important campaigns going on already around trying to stop GP practices closing, around trying to stop resources being moved out of one hospital into another, around the closure of dementia care homes in this area, which will have another knock-on effect on the NHS and the ability to discharge patients safely into the community and look after them properly. So there's lots of those campaigns going on already, which we're kind of bringing together. But like I said, we kind of anticipate that there will be more cuts and closures to come. We can see the strain that, for example, practices around the area are feeling, and it's quite possible that some will be threatened with closure. There's huge strain on some of the community health services like district nursing and other services which need massive support, and there's potential for campaigns around some of those services to try to improve funding and, like I said, to stop the closure of dementia care homes, which is a campaign which is looking like may win potentially. We'll see, but we're very hopeful that will be the case. So there's lots of things like that, but also I think it's about as I was saying earlier, raising people's sights beyond just those campaigns, to try to link up with others that are doing similar things on a national basis. For example, we've had some people going over to Gaul recently, where they've had a big campaign to stop the closure of hospital services there. So we want to sort of show solidarity and help support campaigns around the country to learn lessons from each other, and to try to build something on a much more kind of national level, because the NHS is a national system. National policy dictates what will happen, and we're aware of that. So we try to raise people's sights here, but also to go beyond just our own boundaries, really. So that's why we see it as so important that we need more than just the local new left alternative to Labour, but we strongly feel we need something nationally. So we would actively campaign for that to happen as well, and push for that and support any moves towards that, because that's critically important, I think, at the moment as well. We have to link up with others on a national level, and the thing is, when we do have victories and when we do have achievements here, that's a good example, and we can help others to learn from that, and also we can learn from other people's experience around the country. But also I think it gives inspiration to people, and hopefully, you know, one victory can really quickly lead to others feeling empowered to actually fight back. Because I think one of the problems over recent years has just been people feeling completely powerless, like no one represents them, and that what's the point of fighting, to some degree. And that's where I think in some kind of organisation that gives people a voice, locally and nationally, linking up nationally is so important. Um, and yeah, that's why we're calling for this, for a new party on the left, a party of struggle that's going to fight as well as stand in elections, but actually campaign for what people want, and what will improve people's lives. If you fight, you can win. If you do nothing, then they'll just get away with whatever they want. No, we have to fight back. I think both that campaign and the earlier campaign actually shows that where people are prepared to fight back, that's hugely popular, and actually me getting elected in the past shows that there is an appetite for an alternative to the main parties, if people are given a lead and something to really fight for them, and that they can be part of as well. I think that was the case then. I think it's even more the case now, because it's clear that Labour have moved even farther to the right, and there's a huge vacuum there, that there's no voice for working class people really in the mainstream political parties anymore, and we think there needs to be one that is to the left of Labour, not a reactionary right-wing alternative, which is all that's on offer at the moment.